Hey everyone, it's Riley. I want to do this video for you guys. I am exactly 3 months post-op today. Also, I'm 4.5 months on T, but I want to do a video about my scars for my top surgery. I haven't had any questions, so I'm actually going to just do a video about the stuff that I use when it comes down to what I use on my scars and my routines and stuff. I actually have a couple things that I use mainly, and then a couple things that I bought that I heard is really good, and I use it on weekends mostly, I would say. So two things that I mainly use on weekends because they are very oily and I don't want to get it on my clothes and stuff. Biooil, I've heard a lot of good stuff about, so I use this on weekends because it is very oily though, but and it kind of it takes a while to seep in, so I just like to use it at night when I go to bed. And also vitamin E oil, but this I find is really, really sticky and very runny, so I'm not too happy with it, but it has worked, and it's just I've figured I'd try a couple things here and there to see what I like and don't like. Also, I bought this actually at the McLean Clinic, and it's the only place I know it's been sold. It's about 120 bucks, which is kind of expensive, so I don't know if I'm gonna buy it again. But I've heard good stuff about it and really good results. So far, it hasn't been too bad, but I've been also using other stuff with it. So it's like Skin Medica Scar Recovery Gel. It's in a bottle, and it's like I said, 120 bucks. So far it hasn't been too bad, but like I said, I don't know if I'm gonna buy another one. Also, during the summer, my friend used to work at a factory that made this, but also you can get it at Walmart, shoppers, wherever. Scar Zone, SPF 15. So it has SPF in it. Also, I have spray on suntan, which is like SPF 60 to go over top. So if I do want to go in the sun, maybe for even 10-15 minutes, at least I have like something covering it. Plus, even if I'm wearing a t-shirt or a tank top or whatever, like I'm also wearing SPF sunscreen just in case. You never know. I think your shirts are average of SPF 10 or 15. I don't know. But you can still get sun through your shirts. So I want to wear sunscreen just in case. I don't want permanent scarring or permanent coloring in my scars. I don't really care if they're noticeable or whatever, but I want to prevent it from being even more prominent than what it is now. So also, I have two things that I just recently bought, which is kind of cool. I really like them so far. They're not too oily. I like the texture and stuff, but this one's more of a paste. I'll show you guys here. I don't even know if you can really see it, but anyways. So this one, it's Fruit of the Earth, like cocoa butter, but it also has aloe and vitamin E, which I like that it has vitamin E and aloe because both, are really well known for scarring and stretch marks and stuff like that. So, I bought this one, and also I bought a cocoa and shea butter cream, which also says on here actually good for stretch mark relief, and also I know for scarring. So those two are more of a, I guess, moisturizer type thing. Also, because I know most of these things on there, I know with my doctors and the vitamin E Biooil, it says use twice daily. So for me, I get home from work and I shower and I'm like, okay, there's 5 or 6 hours in between when I have to go to bed to use one of these creams which is usually the one I use from the McLean Clinic during the week. So twice, once in the morning, once to go to bed. But when I get in the shower, I'm like, okay, I'm not, I don't have anything on my chest, and I'm not I don't have anything. So I find in between my chest gets dry. So you know what, I bought at least a moisturizer that only also helps to moisturize, but also help reduce any scars and stretch marks if you have any, or just at least keep it moisturized. So yeah, those are the things that I use, and like I said, I usually use it at least twice daily for sure. Sometimes 3, maybe 4 times if I'm at home on weekends. I like to keep stuff on my chest to help it heal as quick as possible in a sense, or at least to not gain any or too much stretching, because of my job, I'm moving a lot. So I found that the stuff I'm using has helped quite a bit. So before I go, I'll show you guys my chest. So here we go. So this is my chest for you guys for 3 months post-op. Yeah, honestly, my incision lines are pretty symmetrical, same with where my nipples are. Honestly, I really love where my chest sits. I honestly could not be happier with the way that it sits. So, even when I flex, I actually do have a bit of chest muscles, becoming in. So I don't know. I really like it. Honestly, I couldn't be happier. Dr. McLean in Mississauga is who I went to. Awesome job. Super happy. Love you guys. That's it. Hope you enjoyed the video. Be posting it soon.